Hello, I'm Dr. Catherine Vicio, coming to you from Briar Veterinary Hospital. Sometimes our clients have questions about risks of vaccination. So we've written down some of those questions and my assistant Jet will be reading them out. Jet, what's the first question?
Dr. Vicio, are there any risks associated with dog vaccinations?
So vaccines have come a very long way and generally are extremely safe. We do always consider that there are some risks. No medication or vaccination is without risk, but we believe that the benefits greatly outweigh those risks, and we take individual considerations every single time we administer a vaccine. So generally speaking, the risks are going to be a little bit of soreness at the site of injection. There may be a little bit of tiredness. You also have some dogs that may be more likely to have vaccine reactions, either from prior history that we know, or if they do have any underlying medical conditions, we do strongly evaluate whether or not the benefits outweigh the risks, and sometimes we choose not to. But that's really individually based with if a patient has other prior medical conditions. Otherwise, we recommend vaccinations because they're very effective against significantly, sometimes life-threatening disease. And so we'll talk a little bit more about that.
Are there ways to minimize any risks associated with my dog vaccinations?
Certainly. So some things we'll take into account is the health, age, or size of your pet. We can break up vaccines. Here at Briar Patch, we really choose as a hospital protocol not to give all annual vaccines at one visit. So we'll limit it to 2 vaccines per visit. We believe that allows the immune system the ability to mount an appropriate response to the vaccination and not be overwhelmed. So minimizing risk could be breaking those vaccines up, not giving them all at once. It can also be things like if you do have minor vaccine reactions, so a little bit of soreness or swelling at the site of injection or pain, we can give Benadryl beforehand in order to reduce the histamine release that comes from some vaccine reactions. And then again, being prudent about what your particular pet's risk factors are, whether or not to vaccinate them based on their social profile, how much they interact with other pets or with wildlife areas.
Are vaccinations painful to my dog?
I'd say vaccinations are a little uncomfortable. It's a quick needle, but they are not dramatically painful. We give them underneath the skin. They're not in the muscle. Intramuscular injections tend to be much more uncomfortable. This is very quick, simple. Most pets do not notice at all. Others can be a little bit more sensitive but are easily distracted with a snack like cheese or peanut butter. And I would say, very different from a lot of the intramuscular injections that we get that can be quite sore. These guys tend to do great with them.
Can my dog get cancer from a vaccine?
There's a lot of discussion around that. The evidence does not support that cancer comes from vaccines, especially dogs. There have been evidence about cats with certain adjuvants developing tumors. So science has responded. We have changed those vaccines so that there are the safety profile has significantly improved, so that is not a risk factor. Dogs, we haven't seen that same issue. Always learning, but no, your dog cannot get cancer from these vaccines that we provide at Briar Patch.
Can my dog have an allergic reaction to vaccines?
Yes, so allergic reactions to vaccines are possible. Those are very individualized. Statistically, it's a very low probability, but those are the type of things that we watch for and we'll talk to you about whenever your pet comes in for a vaccine. The main things you might notice would be like facial swelling, hives, vomiting, diarrhea. And if that ever occurs, we note it in the record. Typically, they respond very quickly to medications like Benadryl, sometimes steroids if really needed. I would say the chances are probably lower than being allergic to a bee sting. We rarely see that happen. But if so, again, we do take that seriously and mark that in the patient's chart.
Is it safer to opt out of any non-core dog vaccinations?
Well, safety is really the question, right? So is it, if your dog is exposed to many dogs, let's say at dog parks or daycare or agility or dog shows, they are unsafe being exposed to all those potential diseases. So in that situation, I would highly recommend vaccinating them for the non-core vaccines, things like Bordetella, canine influenza, that are highly contagious respiratory pathogens. And then depending on your risk profile, if you're out in the woods, hiking a lot, going to areas where there are deer, even here in Ithaca, right downtown, we have deer going through the parks, through people's backyards. So our community has a high exposure rate to wildlife that can transmit things like leptospirosis in the urine, as well as Lyme disease. They're dropping ticks all over the place. So for dogs that are doing those activities, it is much safer to get vaccinated. When in doubt, I promote vaccines to keep your pet safe so that they don't end up in the hospital with severe illness or potentially, even death sometimes with things like parvovirus or Lyme nephritis can be a really bad one. But certainly, we feel that medicine should be individually tailored. We're not going to recommend vaccines if your pet is not at risk for those.
Are certain dog breeds prone to adverse reactions to vaccinations?
I would say there's not strong evidence to support that any particular breed has a poor response to vaccines. It's really more individual. There are certain dog breeds that are more prone to reactions to things like ivermectin, which is in heartworm prevention, but not the vaccines themselves. All right, I think those are the end of our questions. As always, if you have any follow-up questions for us, please feel free to contact us or visit our website. Thanks for watching.